And today we have the honor and pleasure of talking with Dr. Siri, one of the chiropractors of True Whole Care. And we're really so happy to have you on, Siri.
Thank you, Dr. Sinett. Happy to be here.
Yes. So, Siri, what made you want to become a chiropractor? How'd you get to this point?
I grew up in a household where my parents owned a drugstore. They were both pharmacists. They owned a drugstore. I grew up in that drugstore. I was given a lot of medications, and I didn't want to go down that path. And I met in my sophomore year of college, I met a chiropractor, Dr. Arnold Goldschmidt.
Right.
And he had a dinky office up on 42nd Street, but I went in and he sat me down and he explained to me that I can help people with my hands, without drugs, without surgery, with my hands. And I went, that's a thing? And I had
Right.
like the heavens parted, and this was what I wanted to do.
It immediately became your calling?
It immediately became my calling, 100%.
Right.
And by 1982, I was practicing in New York City on 38th and Park. I was 23 years old, and it's been 38 years now, and I've never had a moment of doubt about what I was doing with chiropractic.
And you love it, and you still love it.
I can't imagine any profession that I could be doing for 38 years and still love what I do. Love my patients, love what chiropractic does for people, 100%.
Right.
And I foresee doing this for, as long as I can, choices. So chiropractors, I think universally, look for the root cause of someone's problem. To me,
Okay.
There's 5 root causes, and I won't get into all of them in detail, but there's the chemical cause, which is food and environment. There's the emotional and spiritual aspect, stress and work and family and emotional trauma. There's the sleep factor. We all need proper sleep for health. And there's movement. We have to move. It's about posture, as you know. There's the genetic component, which we can't really affect right now, although that's changing. But
Our family gave us that.
And then the 5th is the structural part. So structural part is the chiropractic part, and our structure determines our function. There's a brain-body connection, and chiropractors do our best to keep that brain-body connection neurologically clear, because health has a lot to do with neurology. So I'll talk to someone about those 5 root causes and see which one or multiple ones of those are affecting their health.
Siri, I know that when you're treating the patients and seeing your patients, you're giving so much love and care to those patients. But how would you describe your technique? Would you say you're heavy-handed? You really do a lot of heavy adjusting? Do you do a lot of stretching? What is your approach to that?
So over the course of my career, my technique has really evolved and changed. So what I've discovered for me and what I do now is I do a lot of non-force or low force technique. So I'll do some myofascial muscle release. I do some instrument adjusting with an instrument. I do some applied kinesiology, as you do, to help determine where and what I want to adjust. And then my main technique is called sacro-occipital technique and cranial work. I'm a sacro-occipital therapist and a craniopath. And it's all about listening and looking for indicators in the body to see where that person is not functioning at 100%.
And you love those techniques?
Yes, I find them very effective, and it's any laying out of the hands with sincerity and specificity, patients are going to get better.
I mean, probably the most wonderful aspect of you is you ooze sincerity, Siri. You really do. In everything that you do, even when you're just speaking here, we can see it just coming out of your pores. So True Whole Care was so happy to have you join us. I don't remember how long ago you've been to joined us in True Whole Care. How long have you been in the office?
the end of 2013, so 7 years.
All right, goes quick. So tell me what you love about it. Tell me what brought you to True Whole Care and what you find unique and different and what you love about it, because we absolutely love having you.
Absolutely, and I love being there. So for most of my career, I was married to a chiropractor, and we had just a solo office, first on the Upper West Side for 20 years, and then in Southern California for about 13 years. And then when I got divorced, I moved back to New York, and I was introduced to you through another chiropractic friend. And when I saw
Davis, right? Dr. David Davis?
Davis, yes.
Yeah.
And when I saw the office, I had never been in a multi-doctor office before, a multidisciplinary office. And I absolutely fell in love with the philosophy of being able to work with other doctors. So I love that when I see a patient and I'm not either 100% certain I know what's going on, or I need help, like co-treating that person, there's a physical therapist there I can call on. There's a physiatrist there I can call on. If someone needs a PCP, an internal medicine doctor, there's someone right there. So I love that almost everything I need in terms of helping my patients is right there. I can't help everyone, but I know someone who can, and that's what I love about it. And one more thing.
Go ahead.
I can't imagine being in another office where everyone truly likes each other and is really a good, solid practitioner. There's not one person I wouldn't trust with my patients. And I'm so thankful to have everyone there.
Well, the only thing I can tell you is that we are just so thankful for you to be there, because everything that you're saying about True Whole Care is really, one, I believe true, but two, I mean, you are the essence of True Whole Care. You are someone who is very inspiring. You exude energy. What inspires you? And, tell me about your tap dancing.
Well, my hobbies include dancing, yes. And I've also just started taking guitar lessons. So now I'm playing guitar. So,
and can you tap and play the guitar at the same time?
I have not tried that yet. I think that's going to take a little bit of time. That sounds a little vaudeville for me. I'm not sure I want to do that.
All right. So obviously you've been a chiropractor for many years, right? And you've had, I'm going to say, thousands of success stories, right? But is there any one theme or one patient or one story that stands out to you that just feels good in your soul, that's one of those stories that you just want to share?
Gosh, there's so many. I think the cases where people come in as a last resort before they need surgery. Chiropractic is often a last resort for people, as you know. So there's many cases where people are trying to avoid that low back surgery. And me and other chiropractors have been successful in getting that person back to a point where they don't need that surgery. And that's the biggest success story. And there's multiple ones like that.
Well, Siri, there are 4 or 5 other chiropractors in the office, and we each have our different techniques. And, I always describe you as light, loving, and super caring. But, what makes your technique different, or what would you like to tell patients that's kind of your wheelhouse as opposed to someone else's wheelhouse in the office?
So first of all, I'm the only woman chiropractor in the office. So that makes me different. There are some people, especially women, who really only want a woman doctor or a woman touching them. So the fact that I'm the only woman chiropractor in the office definitely makes me unique. And I take care of a lot of pregnant women and children. Not a lot of people know that. And I think just if I can say it, my energy, I have I love to say that I have, I treat with TLC, tender loving care. So I think my energy, I feel like I'm a healer. So my hands are healing. So I think between the fact that I'm a woman and the fact that I feel like I treat with tender loving care is my sort of uniqueness in the office.
And I mean, I would also say that your specific techniques make you stand out because
Yeah,
you're certified in
true.
techniques that other people aren't. And what are those techniques and why are they
Yeah,
different?
I do mostly low force technique. I use an instrument, but my sacro-occipital technique and my cranial work is not something anyone else does in the office. So that's very specific to me.
And you've
Those
been taking a lot of training on that and you're certified in that technique, correct?
I'm certified as a sacro-occipital therapist and a craniopath, and I'm a technique junkie. So I'm always learning something new because that excites me, and I can bring it to my patients. So yeah, I love technique.
What do you think you're most proud of professionally?
Professionally, I'm most proud of the fact that I've been doing this for 38 years, as I said earlier. The fact that I love to go to work every day after this many years with the same passion and purpose, 100%, that's what I'm proudest of.
All right. And what are you most proud of personally? Other than the tap dancing and maybe your new guitar lessons, of course.
My two daughters, they're 26 and 28. They were born at home. They didn't have an antibiotic or a drug as I did until they were almost 20 years old. And I'm most proud of my children.
All right. And what do you mean born at home?
I had my children at home with the midwife.
All right. That's a fun story.
Yes. Yeah.
Well, again, thank you so very much for joining us, and thank you for being the essence of True Whole Care. And
And thank you for what you do. Thank you
it's
for putting together such a team.
our pleasure.